were chatting before the show,
Yes. Yes.
and we were saying about super, and then of course super patch. So I think that was our
Absolutely. Oh my gosh.
our entry into
Yes.
tonight's topic of man, you can kind of walk us through,
I
this
will.
I'll call
Absolutely.
it this find, right? Because this is really
It's
something kind of
total
unique.
random find, and it's alien tech as far as I'm concerned. This stuff
Right
is so amazing.
this thing, like, right? The freedom. There
The
you go.
Band-Aid. It's this is a non-medicated patch, a Band-Aid for lack.
Yeah.
It's like a 2-inch square patch. There's no medicine on it. It has a texture to it. And that texture,
like a
when you wear it, yes, sir?
Like a fingerprint.
Like Braille, yeah. Yeah, it's a fingerprint. And then embedded in that fingerprint is a secondary texture that sends almost like a Morse code or Braille or a QR code. I'm not sure what would resonate with the crowd.
Right.
But it's like a QR code, basically. When you put it on your skin, your brain scans it and recognizes the signal. And the signal tells the brain to go back to homeostatic level of function. So, you've got all these different pathways that control different things, whether it's stress or your ability to sleep or pain or your ability to concentrate, focus, or balance, your metabolism, athletic ability. These things are all controlled by feedback mechanisms in the brain. You can do EEGs on people, like these three-dimensional EEGs, and you can see that in most people, you're not firing on all cylinders. Let's just face it. There'll be parts of the brain,
especially as you get older, right?
Yeah, exactly. So you can see the parts of the brain where it's moving too quick. Anxious people, that thought is moving through your brain too quickly. And people who can't focus, it may be moving too quickly. People with no balance, moving too slowly.
Right.
So they're out of whack. And these devices, when you wear them and you're doing the EEG, you can see slow pathways get normal, fast pathways get normal. So it gets everything into the normal range. Now there are so many different pathways. There's literally a patch for almost every pathway.
Right.
And right now, I personally will not leave the house without the one stress. I am 100% convinced most ailments in this world, the craziness in this world, the gut problems in this world, a lot of it starting with undue stress we put upon ourselves.
Sure.
And that little patch is like a hug and a Band-Aid.
It's kind of interesting because in seeing this technology, and then of course, Mr. Researcher going, let's see what's out there, what's been out there, what's, of course, we're looking at some forward projects with just clinical trials and things like that. But really it's, part of it actually has been used in athletics, right?
Correct. So the first, kind of an interesting story, the founder of this company started his mission many, many years ago when his mother got diagnosed with MS. So he was looking for an answer to her balance issues, coordination issues, and he was studying a lot of medicine, Western medicine. He's an engineer, so he's kind of an entrepreneurial spirit and an inventor, kind of, right?
Yeah, he writes code.
So he writes code, right? And he specializes. This is interesting. He specializes in looking at extremely complex systems and finding erroneous code that's messing stuff up. That's like sort of what he does for a living on computer.
Right.
Okay, well, in his mind, the brain is nothing more than a computer, and the code is off. Like if something's dorked up, the code is wrong.
Right.
So he wound up giving a lot of money to a European neurology society, which then gifted him 2 million EEGs with the patient's basically data, not their names, but their ages, their diagnoses, their medications, et cetera, So he could look at what is normal,
Yep.
what are the different diseases, and where is it abnormal. And he goes, if you look at regular EEGs, you maybe not see it. So he wrote code to find where is the aberrant
It's a little snip.
thing. A little, yes. And he says, just like your heart has a heartbeat, the brain has like a signal. It's there. It's in that EEG. You just can't see it if you're only looking at it. You really do need a special computer to figure that out.
He's doing this stuff on supercomputers with really, really powerful software. Like
yeah. It's like if you were an evil genius, he'd rule the world. And fortunately for us, he's working for his mom. Thank God.
That's right. He's helping with balance.
Right, he's helping his mom with balance. Well, so he's studying acupuncture, acupressure, reflexology at the feet because he was like, oh well, the problem seems to be in her feet. Maybe reflexology is the answer.
Right.
And he just kind of combines all of these concepts, and he discovered a very particular pattern. Touching the feet straightens out the cerebellum and balance issues. Okay, so the guy started by making socks.
Right.
He still sells those socks and shoe inserts, and they started basically with athletics. They're in Canada for hockey players, right? So serious hockey injuries happen when players are off balance.
Yep.
And every kid, male and female in Canada, is playing hockey. Their moms don't want them injured. It was sort of a sale to moms. Look, put this insole or wear these socks. They will have better balance. Like it hurt themselves. So that's kind of how they started. And then he started playing. Once he figured that out, then he started working on other pathways. And then when they invented 3D printers and stuff like that, all of a sudden he can churn and burn with the concept. He knows a disease state that he wants to treat, let's say, or manage or focus on.
He just needs the data.
He runs the database of EEGs. Do people with pink eye, I named the disease, have a different EEG? If the answer is yes, cool. Then he tries to figure out what pattern can he play with to make that EEG back to the green zone normal. And then he trials it on people, and they do their white paper stuff. And they always test everything with EEG. So it's not just sort of the patient's word for it, because, of course, you see the patch on your skin. You can't feel it.
Right.
That would be enough of placebo. So they do studies with a placebo patch and a regular patch. They look identical. And so there's your freedom.
Open. So the freedom.
And this is kind of, the freedom patch is sort of how I got involved.
Okay.
Because with me and my psoriatic arthritis, some of my last messages, especially on my knee, I couldn't exercise. I couldn't go up and down my stairs. It was the one last thing that I really hadn't beaten with my clean diet regimen and whatnot. And so when I interviewed with that guy on a TV show, I took him aside and like, dude, you've got to tell me, and I need that. I bought hundreds of dollars. I bought like all of them. Yeah, no, I did. I'm like, oh, which one does this do? What does this do? Everyone I know is getting the patch. But there are days where I'm wearing 4 patches. So anyway, but that thing took a while to figure it out. What's that?
Just take the sleep one off.
Yes. I take the sleep one off, but everyone else, all the other ones stay on around the clock. And the pain patch took a couple days for me to figure out exactly where to put it. When I got it there, I could go up and down the stairs, and ibuprofen is all I really need at the max. So it really was life-changing technology. Their study on that freedom patch in particular, people who use that by day 4 are using 80% less pain medication than those in the placebo group.
Right.
So there's definitely something to be said about it,
Yeah. So where do you put your patch? So your pain patch.
So for me, it's my knee.
Right.
It started out with both my knee and it started with my shoulder, my knee, my hip, both hips. It's a diffuse systemic disease, right? So, but the ones that limited me, shoulder, hip, knee. And so I put them as close to the pain as I thought. And what I found actually in all 3 instances and I didn't get it right in any of those instances, where I put the patch, and then I thought 4 or 5 hours later, why did I put that patch there? Because it doesn't hurt. It hurts below the patch. So then the next day, I just moved it a little bit lower and kind of chased the pain to its maximal intensity. And then once it was there, it didn't hurt anywhere else on the leg. It was kind of a fascinating thing. The other patches are not site specific. You can put them anywhere. So I usually will put them on my thighs or something like that, just so they're out of the way. I'm a surgeon, can't have it on my arms.
Right.
But at night, you can put them on your arms, sleep at night, and all of their trials, it's the smooth skin on the forearms where they put all their material on the trial. So, but any patch of skin that's flat and not too loose,
Yeah.
not too hairy, not too loose.
Okay.
Alien.
So what else is from a clinical trial perspective? I think you've been looking at some things within the hospital setting, and how just having more robust data, especially in that setting, and how that can help patients out there with some of these issues.
For sure. There were a couple things on my radar for me that if it's working for me, it's going to work for my patients. One of the main complications people have, and I do pelvic floor stuff, the audience may or may not know that. These people, you do not want to have constipated, right? They're already an anxious group of people. If you've ever met anyone with pelvic floor dysfunction, they have a tendency to be a little stressed. They have a tendency to be constipated. That's one of the reasons I would get involved. And so I don't want these patients either stressed or constipated, because I want them healing. Like whatever I can do to max their healing is what I want to do.
Right.
So my first instinct was tell the patient, I don't make people buy this stuff in my office. You must buy this like the orthopedic surgeon does. But it's one of these things. This is cool. It's alien tech. Here's the papers. It works on individuals. It may work on you. And so if you want to help, these are the 4 that I suggest. Okay. My next thought was, now wait a minute. When I have patients in the hospital, get them home quicker, I really avoid, if I can, narcotics, sedatives, etc.
Right.
Why? Because those things lead to complications.
Right.
The most notorious of which is falling out of bed and whacking your head or doing something terrible like that. So then the question became, and there is no
constipation, along with
it
just keeps all those things that you're trying to free up.
You're chasing
it.
your tail, right? So one of the reasons I talk so much about nutrition is because I'm trying not to use medicines, because medicines have side effects, and you start chasing your tail, and now you've screwed everything up and you don't know where you stand. So I like to kind of go all natural to start. Let's just kind of try to do it without medicines. And that's true for every aspect of my practice, including pain. And so in this instance, I asked the owner of the company, do you have any data in a hospital setting in regards to falls? I mean, you got this balance patch you can prove. They've got all these different physical therapy studies that show it helps balance, athletic performance. They take athletes like them and do their whatever.
Right.
They can prove in that way it works.
Yeah.
But it's important to me if old lady Jones can get out of the bed and make it to the bathroom without falling down. To me, that's the most important data.
Right.
Not that my 8-year-old can turn on a radius at 18% tighter. I mean, the 8-year-old appreciates that.
You just hope he goes pro.
Really. They all want to go, well, look, professional athletes use these products.
Right. 100%.
Olympians and professional, because there's no drugs in it. And it truly will ramp up your athletics. Having said that, the little old lady, she just wants to go pee. It's really, so that was kind of an opportunity in my mind to have a landmark study in the world of enhanced recovery after surgery using a technology. There is no competitor technology. Full stop. There's no batteries to this. There's nothing. It is a texture like tweed is a texture. I mean, like it's
Yeah.
a texture. That's it. So it's not even a medication. It's not considered part of pharmacy. It's a medical device like a Band-Aid or a knee strap.
Yeah.
So people need to think of it as externally applied physical therapy.
Well, it's like
not really.
It's like the tape, right? I mean,
K-tape.
that's that.
It's like K-tape, and that physical therapy tape truly has a CPT code that can be filled in a medical office, showing the patients like where you're going to put it and so forth and so on. So for the occupational physical therapists out there, which you probably have watching, you do public floor
Sure. Yeah.
discussion.
Yeah.
This is no different than a sit down, externally applied K-tape sort of discussion.
Yeah. And then kind of walking them through, hey, we're going to start 9. I'm going to need your feedback, and we want to get a baseline, and let's see where it's going to lead to, right?
Exactly. So providers can bill for their services when they have a conversation about one of these patches. Okay, that's important for doctors to understand.
Right.
That not only is this technology helping your patients, but
PTs.
if you have the conversation, it's a reimbursable conversation. Please have the conversation. The second issue is the device, because it's a device. This is the racket the orthopedic surgeons have had forever. The device is paid for by insurance because it has a CPT code. And in fact, the company is working right now with Blue Cross and Anthem and United and Cigna to make it a formulary in the same way an ACE-RAP or a brace or something would be. So these devices are FDA approved as externally applied physical therapy device. You, the therapist, you do not have to be a doctor, can bill an insurance company or the patient in cash for this discussion and for the device. And the hospital proper can bill for physical therapist who has the discussion and the device with the patient. So it's helping the patient, and then it's helping the doctors, but more importantly, it's cheaper than medicine without the complications.
Right.
So the only people kind of upset about this conversation are the pharmaceutical industry that have pills. And so my job is to try to take away some of that pill pressure, so to speak, from the patients. So this is a cheaper alternative without complications. And again, from a physician standpoint, bonus to me, I do not get paid to hand a patient a prescription.
Right.
That's bundled into my conversation. Me sitting here and talking about the dangers of Vicodin, unpaid for conversation.
Right.
And if I don't have it, I could lose my license. Right. So, this is a very different incentive structure for the physician and the therapist out there in the listening world. And for the patients, and I'm sure you've got a ton of patients who are watching.
Definitely.
Wouldn't it be nice to know if you got tennis elbow on the tennis court? No, you don't have to take a pain medicine that's going to worsen your constipation and blow out your rectus repair.
Right.
That'd be kind of nice.
Right.
No, you don't have to take Ambien on the airplane to help you sleep, and then have a viral video of you acting like a weirdo, because all those videos are Ambien.
100%.
So the sleep patch, 100%. So like the sleep patch is not going to make you drowsy, it's not going to make you goofy, but when you close your eyes, your brain starts to organize the sleep pattern, even if you're in a weird situation. So for business people, for doctors, firemen who are on call, need to get 5 hours of sleep. You can't take a sleep aid.
Right.
What if they called you? And you have to work tomorrow. Can't do it. So this is extraordinarily helpful for that clientele, whether you're a pilot or a traveling or a businessman like you are and whatnot. So
when your time zones are all mixed up,
all dorked up. So, but what
West,
Jay, the inventor of the patches, tells me, the mind is a fascinating thing, and your mind can move mountains if you choose to. Which means if you belligerently did not want technology to work, it would, because you can override a lot of this by ramping up beyond the capability of
Right.
Just like if I wore an ACE wrap, does that mean I don't have a dorked up ACL? No. You know, yeah, if I went running up a mountain, I might possibly hurt myself.
Right.
So you really do have to keep in mind it's not a cure to anything. You have to think of it as a brace or a strap. The second the brace is gone, unstable knee. I mean, you just have to think of it that way. And so, also, just like if you're wearing a brace and you're doing an athletic event, certain maneuvers you can't do with that brace on and not expect something to not get out of whack, right? So you do need to kind of be compliant in that regard. But you know, he's got one to help people quit smoking, and he's got one to speed up your metabolism, and all of those things to a willing mind. It's shocking how well it works.
So which ones are you taking or utilizing?
So
Not really taking,
I
utilizing.
use I've got several slapped on my body at any given time. The peace patch is the one for stress.
Okay.
It's a light blue one. It's for stress, and I wear it. I always wear that. There is another one called the Defend patch, and this one stimulates the immune response. It also improves blood flow and decreases the risk of blood clotting. And so it's called the
For
Defend
airplanes.
patch. Really good for airplanes.
Right.
And the CEO of the company says that is the one that he wears on a daily basis because he's not getting sick from people. He's not getting blood clots from people in the COVID world where people are getting these weirdo clots from COVID and, you know, other medications associated, I should say,
Yeah.
without getting you blackballed. Anyway, those things all cause clotting because that protein in the virus causes clotting. And so, and they could do blood tests to show the difference between someone before that patch is on, what it looks like, after the patch is on, what it looks like. It is rather remarkable, and it is true for every human being. Probably not true for your animal because he doesn't know what an EEG of a dog or a cat looks like. But he says people do try to slap it on their animals to see if it helps them. But he's not willing to make that comment that it will work on. But anyway, so I got these, I got the Defend, and like all women out there who are menopausal, I'm exhausted all the time. So I wear the one for metabolism because it gives me a little bit of a boost without caffeine, so that at night I can take it off and replace it with a sleep patch so I can sleep. Because if I take that little dose of coffee or caffeine after probably 11 o'clock in the morning, it really kind of messes me up. I can't fall asleep quite as well. So this helps limit my caffeine intake, keeps me up with a little metabolism. And then the sleep patch, talked about that. And and then the balance. I actually wear the socks for the balance. He's got a sock thing. And he's phasing those out a bunch. But the one for balance, I will wear if I don't have clean socks. So those are the ones that I wear.
I will have to check it out. Maybe we have to buy some wholesale stocks, you know, like
yes.
cases.
Yes. Cases and cases of they have athletic insoles and athletic socks I got for my son so he doesn't get hurt playing rugby. And
I'm gonna make sure I call
balance,
him and I'm gonna say, hey, let's talk about some hockey inserts for my roller skates.
Yes, exactly.
Anything that.
So anyway, yes, that's what he's doing. And I've got everyone I know on these patches. I love them. They're awesome.
Including me.
I've got patches, yeah, including you. Literally, you can't walk by me without me slapping this patch on. And I you know what is I find fascinating that you really don't realize that they're on, except at the end of the day, like the peace patch, it's like, I was stuck in traffic for an hour and a half. I didn't flip a single person off. I'm a surgeon. That is something. How did that happen? You just kind of feel like, you know what? I'm okay. I don't have to get angry about that.
Thinking I could go to the mall and just pass them out to all the people that are trying to get in and out that are angry.
Yes,
Right.
yes. And the study on the peace patch is if you took expert meditating, somebody who knows how to meditate,
Right.
expert meditator, so some kind of guru on meditation, and you do an EEG on them after 4 hours of meditation, that's the exact effect you will get within 5 minutes of putting one of these patches on. It's an intercom. It's so awesome. So I will not. I won't live without that one. I have to have it at all times. I don't care how many patches. You only have to wear one at a time. You can't wear two or three and make yourself even more calm. It doesn't work that way. But if I'm wearing something like shorts, I just make sure you can't see it. That's fine.
Yeah.
If I'm wearing a bathing suit, it's gotta go underneath the bathing suit. I gotta have it. I'm kind of addicted to it. So
So catch me up. Instagram, Dr.
yeah,
Cooper Fixer.
what's up with that? Yeah. So okay, and I did change the moniker to just my name so people can find me. So it's just Dr. Anna, formerly the account formerly known as Dr. But Dr. Anto, but that's it. And because I do spots on Brinks TV, which is another thing you people should know. This is an awesome wellness show. It's 30 minutes Monday through Friday. The name of the show is about to change to Food Freedom. I'm on there probably once a week. And it's a
What's
streaming
it called?
service.
What's
Great.
it? I think we spoke about it last time. I know.
Yes.
Have they changed yet, or they're going to?
Yeah, they're changing January 1st.
Okay. We know what it's changing.
So right now, yes, it's going to be called Food Freedom. What it is right now is called NIL House Nutrition, but they cover so much more than nutrition.
Right.
They cover sort of lifestyle, body, soul, wellness. Think outside the box kind of stuff. I talk about medical things. So they decided to call it Food Freedom. Freedom being, instead of always thinking about, I'm on this diet, I'm on that diet. Oh, I can't do this and I can't do that. It's more about knowing what's in what. And you and I know, have talked about a million different the stuff they put in the food.
Right.
So if people knew what the words were to look for
Right.
on the label,
right.
And if they knew that stuff is what was causing them to have blood pressure issues, that they're now on the fourth medicine.
Yeah.
You can't lose weight. People don't associate, I can't lose weight with the stuff they're putting in your food. They just think, oh, I need to do sugar free. Stay away from carbs. I'll go keto or whatever. Yeah, but if you're still doing all the processed stuff, it's just not going to work.
Right.
So anyway, it teaches these
a lot more depth.
And gives them knowledge. It's free knowledge. Please join. Okay. So because of that, and I'm on there as Dr. Anna Toker, they told me to change the name on Instagram, which I did. And then they said, Toker, we need you to promote. There's an upcoming product coming out, which I actually am very excited. I got to help them. I got to help them find. There were a couple things that they were asking about. If I had my druthers, what would I put in probiotic? It was kind of fun. And well, that comes out in January or February, and I get to be the spokesperson for that. And they don't have a website up yet, so I don't tell you the name, but you'll see when you see my face. Probiotic, that's the one. Anyway, so as I'm discussing this with the team, they're like, okay, we're going to need you to do some marketing stuff. Let me let you talk to our marketing person. And you know me, I'm long-winded. Look how long we've been talking. And she's like, okay, this is your homework. I need you to post 4 videos. It doesn't matter what they're about. Look in the camera and speak for less than a minute and a half. Post it to your Instagram account. Okay. So I do that. Right? 4 videos. I'm doing 4 different things, kind of different backgrounds. Looking in the camera. I'm outdoor for some, indoor for some, whatever. It's my normal spiel that I've been talking about for years. And one of them, for whatever reason, was seen 500,000. I look terrible in that video.
How many times?
Why is that the video? 500,000. It's probably up to 700,000 now, almost a million. Why? It has been seen like years amount of time. Like when you take that minute and a half times a million, it's like almost a year worth of time. People sat and watched this video. How? Why? I don't know. But I posted them the day before Thanksgiving, And so on Thanksgiving Day, I was so annoyed because my phone, people kept making comments. I don't even know who these people are, but I'm answering them. Well, interesting you say that, right? Because I don't know what else to do. I'm just kind of answering them. And as you answer, I guess that's part of the algorithm. I don't know. It's not what I do for a living. I just know that I was answering. Before I know it, I've got like 15,000 followers. And then it turned to 25,000 within a week. So I got like 15,000 overnight and then 25,000 within the week.
Right.
And that was Thanksgiving, and now we're up to 68, almost 69,000. So I gained about 1,000 people per day. And like yesterday, the video I did yesterday was off the cuff, 5 o'clock in the morning, in this chair. I looked exhausted. I was just simply saying, hey, welcome to the channel. And you're going to see instructional stuff from me on gut health. You're going to see promotional videos from my sponsor. If you like what the sponsors are offering, please support them because they help me pay for the social media lady I just had to hire to manage my Instagram account. Like that helps me pay my employees. Would love it if you would help. 60,000 times that video has been seen. So I don't know. I don't know what to tell you. We gained 10,000 people probably overnight. And so I'm not sure what the algorithm is. I don't know what I'm saying. I don't know if someone following me is like real famous and maybe they're one of the comments and I just don't know it.
Sure.
There's a reason, who knows? But the information there is true. It's legit. We've got free resources on there. You can download it anytime. My goal would be in the course of the next few years, sort of go through the entirety of my 30 years of experience. Simple to understand. Yeah, in minute-long conversations that I would have with my patients. This is originally a resource for my patients.
Right.
Okay. It could be a resource. There's people in Australia and Europe watching this. So anyway, it could be a resource for anyone. As long as they know I'm not talking to them directly, I'm just saying, look, if you have this disease, consider the following simple things. This is what this means. When your doctor told you this, let me translate that for you. Right? And so into simple. And that apparently is a popular thing to do because most doctors right now posting videos will talk for 30 minutes before they get to the actual answer, which is, buy my product.
Right.
So to give a minute worth of free information and there's no buy my product, that I guess is refreshing. I don't know. Feel free to buy the product. Yeah, I'm not saying don't buy the product.
Well, at least
it
kind of follows the military aspect of the main idea up front.
Yes.
Tell me what you're going to tell me, and then if you want to continue to listen, if you want me to unpack this, if you want me to go further, if you want to keep listening, I'm going to get you I'm going to squeeze the juice out in 90 seconds, and then if you want to enjoy the juice with me, we can do that. If you want to,
I've got an online program so they can enjoy the juice. You need a deep dive to learn how to squeeze the juice yourself. I do telemed.
It's true.
I'm a doctor. I mean, call and schedule telehealth. We just booked a half a day per week, and we'll expand it as it gets more popular for people all over the world.
Right.
And we've had people from other countries call for 30 minutes to have a conversation. Now, insurance will not pay for telehealth outside the state of Texas because I'm only licensed in the state of Texas. And so if someone calls from another state, even though they have insurance that I accept,
well, it's
a gray area because I.
So may I ask how much do you charge for that? Is it?
We are charged my normal new patient visit $250.
Okay. So
and that's when we bill insurance. And so if I can't charge your insurance, that's what you pay.
Right. So the other thing is you give them the invoice. They can file it.
Yes.
They can either they can apply it against their deductible.
Correct. And they can pay with an HSA card. I mean, as a doctor's office, if you have an HSA card or you need the receipt.
That'll save you 40% right
there. Yeah, I mean, right. So that just utilize the healthcare system, and while the actual consultation is not insurance paid for, what I'm telling you you can write off somewhere someplace. I'm an actual doctor, right? I'm not just a nutrition coach where that doesn't apply. The other issue is
I'm sending you a patient in January too, by the way. Someone who's been to everybody and got some crazy IBS issues.
I love this. No, I love to solve a problem.
Right. Especially if
I love
they've been dealing with it for years and years and years, and they've been to specialists. You love unpacking that.
Yeah. And so usually, and if they need a follow up, fine, we bill a follow up. It's no big deal. There are some of these patients, I know in my career, I had patients come from all over the country to me for whatever reason. I don't know why. It's usually word of mouth. It's because I speak simply. I have a good reputation as a surgeon. Some of these people probably will come see me if they require an operation, but really my intent is not for that to happen. It's for me to say, listen, this is what you're going to try at home. You've not had a colonoscopy. Oh my gosh. Call your gastroenterologist. You need a colonoscopy. You need this test, this test, this test. I can't order it across state lines because I don't have a license in New Jersey or whatever.
Right.
But you can go to your primary care doctor and ask for the following XYZs. And if they won't do it, fly to Dallas.
Yeah. Easy.
I'll take you walk into my office, I'll take your insurance.
Right.
It's simple enough, right? So there's more than one way to skin this cat. And but honestly, you either have time or you have money. And if you don't have money, give me your time. Give me a minute, 2 minutes every day. Ultimately, will cover the majority of what's important. And I get a lot of the topics for my videos based on feedback.
Right.
Those patients comment in the comments, have you ever talked about this? Or could you go over this? Whatever. So we're starting out, the person I hired is in charge of cataloging videos into, sort of like
subcategories,
topics. Yeah. Let's, and then we'll give everything a cool title. Because honestly, for 2 years, it's just me chit-chatting. People follow me. Oh, that was cool. I learned something. And that's it.
Right.
None of them were labeled. So I will have to redo all those. Are way too long. But anyway, so that's
the master of all categories is Dr. Red Allen Sod. If you've seen Gyn Flicks, GYN Flicks, he is, he's an artist with the camera and the photography and the videos, but then on top of it, just how he's categorized it is, that whole thing of
is entertaining. Oh, I'm gonna have to watch it. I'm not a gynecologist, but I'll have to.
You have to check out his site because it's and how it's built, because he did an absolutely fantastic job. And by the way, he's now in Dallas. He was
really?
So his kids are in Dallas. So he and his wife moved to Dallas, and he's wrapping up his practice in Laguna Beach. So Red Allen Sod is in your backyard.
Is he gonna practice in Dallas?
He's practicing in and around the Plano area, like North Dallas.
Damn, that's so far away from me. Because as I get older, like I'm looking, I need people to, like I need doctors that I can help, like connect patients with.
Exactly.
There's so few and far between who are good at what they do. There are a couple in town that I like to use, but there are some that I'm like, I don't know.
Right.
I don't know if that doctor did service to that patient or not, So I do like a thorough person. All right, I'll have to keep that in mind.
I'll at least get you connected. We'll go grab a lunch or something, and
awesome.
I know he's always willing to collaborate, and it's always good to have someone.
A good surgeon people will drive for. Yeah. The issue is, does he work with a colorectal surgeon, and that's who is that? Does he need to meet them? Because I do know several very good colorectal surgeons in that area.
Okay.
We'll have to have a conversation with them.
All right, offline. There we go.
We can. Yeah.
So,
what else?
Congratulations. That's it. We're gonna. I've got super patch. I just got these from Jay, so I will let you know how they work on our next.
Okay, the sleep patch goes on an hour before sleep.
Okay.
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 It's not gonna make you feel sleepy. So don't stick it on there and stare at the TV. God, I don't feel tired yet. I better not go to sleep. No, it's like if you go to bed at 9 o'clock, 10 o'clock, or whatever your time is, an hour beforehand, put it on there, kind of go through your regular routine bedtime, lay down, fall asleep.
Can't wait.
I know some women will put it like on their chest and too loose.
Okay.
The patient, the women who put it here on their chest, it doesn't work. If you put it on
Forearm.
in like this,
Yep.
forearm, if you probably have a muscular belly like the rest of you. Your belly, my husband puts his on his belly.
Okay.
But for some place where it's going to make good contact, and then you tell me. It's just amazing. And then the peace pack. Did he send you peace
He
packers?
did not.
Tell me you sent you peace packers.
He gave me Liberty.
Okay, yes, that's the balance one.
Right.
All right.
And then the Freedom.
Freedom. Yep, that's for pain.
That's for the pain.
Yep.
And then the REM. REM.
Okay.
Rapid eye movement.
All right.
So yeah, I'll have to ask him for the peace patch.
Yeah, I'll send you some. When are you coming in town? When are you coming in town?
Second week of January. I'll be there. I think that.
I will have a
I'll be in the OR with one of your colleagues.
You will?
Yeah.
Okay.
Yeah. So,
all right. Stop by and see me. I will give you a month's supply of peace. It's a hug and a Band-Aid. Awesome.
I love it.
You'll never take it off.
Okay.
Be your best friend.
I can't wait.
Yeah.
I can't wait.
That's awesome.
Well, Dr. Toker, always a pleasure.
Yes, sir.
And
thank you, Rob.
Enjoy the holidays, and I know you've got.
Oh,
So what's your following week look like? Do you get any time off?
I do. So tomorrow we work like a banshee. I probably have 16 colonoscopies, and then next Friday I probably have another 16 colonoscopies and an interstem for incontinence add on. You know, where are we going to put it? But I get Monday through Wednesday night pretty much off.
Beautiful.
So yeah, so I'm going to try to do paperwork, clean up all office stuff on Saturday, so I can just be family Sunday through Wednesday, not really worry about it. And then the Instagram stuff.
You just gotta sneak away and do a couple of posts, right?
It's well, we're planning. They're already posted. They just automatically will load at 7 o'clock in the morning.
Okay.
So we're set.
I'm watching. I'm following.
You gotta watch and you gotta follow. Okay.
Anyway.
And then you gotta watch it on Brace TV. Gotta watch it.
Dr. Anna Toker.
All right.
Always a pleasure.
And I will give you some of this new probiotic.
Oh, I can't wait.
I've got sample bottles, so you're good.
I'm looking forward to it. Thank you.
Awesome.
All right.
All right. Talk to you soon.
Bye-bye.
Bye.